You may have to get to that point because you may be getting clues that maybe this person can afford it, and you want to get a little bit deeper because we don't want to be upsetting our dentists.
Somebody won't figure out a way of beating, and if you sit around and you waste a lot of time and resources trying to do that, you're defeating the purpose of the program. Here, it's very clear that I'm abusing the system, then guess what? It's the dentist who says, you know what, you don't really qualify for this. I'm going to terminate the job because guess what? They've not proven themselves to be honest. That's the way I see this running. Or else you're going to spend your life looking at every bill, every asset, doing all that assessment.
It's not like completely below their cutoff.
And their family income is below?
It's
like, or they can't.
We asked for the house hasn't decided on anything, so I'm still booking in people who have cars and houses. It's just if they can't wait, I tell them, you can go elsewhere, but rent or mortgage, how much it would be approximately per month. Because we don't ask for the exact number down to the penny. It's just approximate.
They paid the previous dental treatment instead of asking what was the name of the last dentist. I mean that. I don't know what that would.
More information on the part of the finance. They want care. They want care for free because healthcare is so expensive. But once they hear the reason why we exist, it's a clinic for homeless. It's a clinic for people that can't afford. So I don't know. Do you do that at
Yeah, I actually tell them because some people come in, they're like their gums are swollen, they're in pain. But then when they come and dentist sees them, they're like, "Oh, you don't need any fillings or treatment or anything. You just need a brush." I asked them before on the phone before I make any appointments, "Are you in pain, or do you just need a cleaning?" But some of them, I guess,
This is where the hygienist would come in.
It would
Really,
be very handy.
really good. If you have hygienists and those people who have bleeding gums see the hygienist before they see the dentist.
We actually do have a hygienist who volunteer, but I'm asking the volunteer dentist how they see the situation, because if the dentist has to write an order for them, so like if any medical history would change or anything like that.
How long is the time? For the appointment with the dentist. Quick look, right? An order in the chart to say to see the hygienist.
Can I ask you in a big problem? We're going to have people that we're at a point where we can help them with their family. Maybe they're starving to death at home, but we're really only worried about their teeth right now. So I'm wondering if
how come we can accommodate him, and also regarding about the financial situation or finance. This is very difficult to define. A car is must. If he owns
and that person may be living in their car and has a car, but they need someone to really help them with getting connected to other resources. It's not just about their dental when we see them. And for coordinating supports for those people.
And you
would help.
You would help? You yourself or your agency?
No, I'd be the one to help.
So would Cindy...
We have a catchment area, say, for a food bank and what have you. But we will not just say, sorry, we won't service you. We'll link them up. So, I mean, all of Scarborough, outside of Scarborough, I mean, we'd have to find out, but the majority of people are coming within Scarborough. So majority of people might fall right into the services from our agency. Now that that would be something, that's what we do. I mean, it is a referral service. Perhaps I would just be the link to see how it would when our agency is here and as we volunteer, everything happens. So we can do it and then assess to see if there's a need for, if I can't manage it. I mean, this would be a good time to find out, we are trying to...
Yeah, so it's not associated with a name.
Yeah, and it might not just, like me, I might have to refer, or,
Mine has been assessed by West Hill Community Health Center. It's on the form, it goes to the dentist, they shouldn't have a problem.
That's great.
Okay. Did you
Also, according to their own private practice, whatever, if we have a number of the patient is really low income and really emergency, they have minimum services to provide to them in their own private practice. That's what I got since last Thursday.
Great.
Yeah. And in Etobicoke, have a couple, and Mrs. Saga have a copy too.
Okay. So advocacy, I sent information to Anne about when the Board of Health meeting is. You got there. Now, what I could do is once the operating budget is tabled, I can send it to you electronically so you can see it. There won't be any meetings after that until January when the Board of Health, when it will probably be discussed a little bit more in details. I have to share with you that the North York Clinic, I know, so did send out the request for quotations to get a contractor in to come and renovate the space, and Board of Health as well in September. So it's really up to the agencies, you know, just what you want to do, whether you want to, as far as being at the Board of Health to speak about dental issues.
Well, this was also to try and, was this to also try and request it to be,
I think Danny and Dr. Orzak was, and we thought maybe of one of the clients. That was our discussion.
Just so you know, what's his name, Brian Hyman from the local health committee, the Scarborough Local Health Committee, he tabled a motion on at the Board of Health. I think I sent that. I think I sent you an email with that motion, but it didn't really. He didn't really name this clinic. He just asked for a gap in the dental program to be reduced. And he didn't really say why. Toronto Public Health operating budget. Then you come to the Board of Health and you have 5 minutes and you state whatever the issue is and you state whatever you think the solution is, the response to that issue is.
We don't really have a solid, we know by our stories, but we don't really have the solid numbers. So I think it would probably make more sense to really have a solid number of stats.
But especially at the time of election, it's the personal stories that the politicians listen to.
we would have to pay their transportation.
That's what the politicians listen to.
Do you think you would have someone that can talk about how this clinic has really helped them and that kind of thing?
Doing this as opposed to fundraising. How about, I'm going to call you, Cindy, you do have a person, and maybe coordinating something of actually, taking them down. Like maybe I'll be driving down with them or something.
Almost informal to do a deputation. You can probably wing it, as they say.
I'm good at winging it.
Yeah,
There you
can
go.
probably wing. If you
But
bring
Bob-
that person, and how agencies have very few places to send people to.
And we could give you our stats up to this point. How much?
Actual time frame, because I guess Dr. Stewart, I didn't see the email, so I didn't even know when it was. If it's feasible, but then what I will do is I'll respond to the groups.
In 2001, I believe, the Wellness Center at Scarborough Hospital approached Toronto Public Health and identified a real need in the Scarborough community for dental care for people who could not afford to pay for dentistry themselves. The Scarborough Hospital had done a community survey, and this was one of the needs that was identified by the community. So in working with the Scarborough Hospital and several other social and health agencies in Scarborough, we applied for a grant, and we did receive funds to purchase dental equipment. The Scarborough Hospital has provided space at 3000 Lawrence to house this clinic alongside the urban health medical clinic that treats clients who are here who are not covered by OHIP and who are experiencing health problems. So this clinic is really a community effort. We have volunteer dentists, 10 volunteer dentists who are very critical to the operation of this clinic. They volunteer their time on a regular basis, and they see these patients without charging anything for the service that these patients are getting. It's an emergency dental clinic, so we see patients who are in pain, who have had some trauma to their mouth, and who have infections in their mouth, and they're seen, and we try to relieve their pain and try to get them healthy. It's a very important service simply because if people are trying to get a job or trying to get their lives on track, you know, you just can't do it without having good oral health. Oral health is critical to your general health and well-being and to your quality of life. And this is why this clinic exists. We would like to see where more services like this are available in other communities for people who are similarly affected. We are booked now, we're booked well in advance, and we try our best to accommodate as many clients as we can from the community.
Since its opening, do you have any statistics about how effective this clinic is?
Well, we've seen, I would say, over 200 clients in the last year, and we're booked for, I would say, 3 months in advance. And it's unfortunate that sometimes people call and they're in real pain, but because we're so booked, we can't see them right away. But we try our best. Yes.
Since you say there's a high demand for your Sunday service, right? So do you have any plan for expansion or future development?
Well, we're going to try and do some advocacy work. We're going to try and talk to the various different levels of government to see if they would fund this. We're also trying to look at some sponsorships. If we can get some sponsors from the community, then we'll be able to expand and we'll be able to recruit some additional dentists and some other supportive services. We have a dental assistant, we need a receptionist, so you know we'll be able to staff up and expand. But you know it all depends on how much resources we're able to gain.
I know that you have like fundraising event. Can you talk about that?
Yes, right now we're having our first banquet. It's celebrating the first anniversary of this clinic, and with the focus on trying to raise funds to make this a sustainable project. So it's a very ambitious event that we're having, but we feel so committed to this clinic and feel that this clinic is so important to the community that we've put a lot of time and effort into having this event and trying our best to raise as much funds and to get as much donations as we can from the various areas of the community.
So can you tell us about the details of the event?
Well, the event is on Friday, September the 15th at the Ruby Chinese Restaurant, which is located at McCowan and Finch. The event starts at 6 p.m. and dinner is served at 7 p.m. We have an evening of entertainment. We have a fashion show, dances, singing, an auction. So it's quite a full agenda for the evening, and we encourage people to support